There are 2.4 million children and adolescents living with HIV worldwide. The good news is we have good medicines for children and adolescents living with HIV, but only half of the children worldwide are actually taking these medicines.
In that age group of adolescents and young people, there are challenges with keeping them on treatment if they are HIV positive. One of the models that has worked is a peer kind of model, young people supporting each other to remain adherent on treatment. And the Zvandiri model is one such model.
When you train young people living with HIV as peer counsellors and connect them with other young people with HIV, it works because they have this shared experience, they understand each other, they can relate to one another, and it really does help them to take their medication, but also, most importantly, to live well as young people growing up with HIV. We call these peer counsellors community adolescent treatment supporters, or CATs, and young mentor mothers.
Over the years, the program is really, grown to the extent that the Ministry of Health and Childcare is actually officially adopted that model and is now rolling out a peer model of support.
We've developed Thrive95 together with the government of Zimbabwe, WHO and UNICEF, which is a standards-based, system-strengthening framework to support governments to scale, finance and sustain peer models like Zvandiri so that we reach all young people living with HIV.
This is a regional consultation meeting that is focusing on all the countries, all 14 countries that are implementing CATS model in Africa. It's the first one.
It's been really wonderful to bring all these countries together to the home of Zvandiri, hosted by our government that has been driving this over the last 2 decades.
This model is really innovative because it addresses a lot of issues among children and adolescents living with HIV, and working with peer supporters of their age really allowed to address those issues in a very beautiful way. And we have seen really impressive results, especially in Namibia.
We've just adopted the CATS model. It hasn't been that long. We started training them in October 2022. We've really seen a change from viral load suppression of 63 to 91%, which is really very important, and we really do appreciate, and we've seen that the model does work.
I think it's a model that we need to replicate across the sub-Saharan Africa region and implement to scale.
Together, as 14 countries, we've achieved so much, which is incredibly exciting. However, there's still so much to do if we're going to make sure that all young people have access to a trained, mentored peer counsellor.
It's quite important to make sure that the kids are in these spaces because they are the ones that are in there, that are in the area, that are in the community doing the work. So I believe that it is important that the kids are in this area so that they can be heard.
É muito importante porque eles lidam de adolescente para adolescente e têm os mesmos pensamentos, lidam com as mesmas dificuldades.
É o jovem que sente todos os dias a dor do outro jovem. Então somos nós que sentimos e é bom quando tem um jovem adolescente CAT que fala pelo outro jovem.
The CATS model has brought in that component of young people's voices being heard. And I think that is very important.
Well, the significance of this consultative workshop is that it brought different people from different countries. Of course, we're at different levels and of different experiences. Even our approaches are slightly different.
When you're working alone, you always think, for instance, what you are doing is the best. But when you meet as different countries and you share, you learn.
You always think you've done the best, but when you get into these conferences and you hear what other people are doing, you actually see your gaps and challenges. So from here, I know exactly the gaps that I want to actually close.
So for me, I'm really excited, and we already have programs that we can integrate into the HIV and AIDS response from a clinical point of view, but looking more at the livelihoods and mental health, which is really absent in our programming in South Africa.
It's really bringing also creating great relationships. I've created really good relationship, for example, with South Sudan and Rwanda. And so it's been really great just to have that diversity. Yeah. I think there's just some great lessons learned that I can bring back. And I'm really looking forward to going and empowering the other Agicat, as we call them in Ivory Coast.
Isso foi realmente uma grande experiência e uma boa experiência para carregar conosco para casa, e sempre estaremos lá para espalhar e advocarmos por todo adolescente vindo com a HIV, assim como por todos os CATs, e assim promovermos e lutamos contra o SIDA até 2030. Grato.
We're enormously thankful that so many countries could come together and take the time to come to Zimbabwe for this really important meeting and opportunity to jointly reflect and share and learn from one another, and that we are really excited about the journey ahead.